So, this is going to be the first video in quite a long series. Um, I have bipolar disorder, as you probably know if you've been watching my videos, and I've experienced a very large range of symptoms. And so I thought I'd make a series that focuses on bipolar disorder. And each installment will concentrate on one of these states or symptoms. I'm going to give you the definition of the symptom, the medical definition, and then I'm going to tell you my personal subjective experience of that symptom. So this is the first video in the series, and I thought I'd start with something very specific. I do think it's a symptom that sort of gets overlooked because it's part of mania, but it's something that's sort of taken for granted. It's not something that's focused on. It's not the problem. The overall manic state is the problem. So I'm going to be talking about pressured speech. Now, pressured speech is when a patient, usually a bipolar patient, but sometimes people with schizophrenia and severe anxiety, they feel this irresistible urge, a compulsion, almost like there's a motor, that they're being driven by a motor, to speak a lot, with a lot of urgency. And when this first happened to me, I was out having dinner with my friend. It was sort of in the week before leading up to my bipolar diagnosis. I became manic and psychotic very fast. A lot of people start turning over a period of weeks or months. I had been in a mixed affective state for a year or two, but it was very gradual, and I suddenly found myself, feeling the need to talk, say something, and it felt very uncomfortable. It didn't come naturally at all. I thought to myself, what's going on? Why am I talking so much and so fast? And why do I not feel good when I'm talking? My friend couldn't get a word in, really. So I was basically monopolising the conversation the entire evening. I don't think it was very fun for her. I mean, she didn't say anything about it. But when I was diagnosed, I asked her, I looked at the symptoms and I asked her whether she thought that I had pressured speech, and she said she did. It's usually quite rapid because it's so urgent. And I think that it's linked, I'm pretty sure it's linked to having racing thoughts. Loads of ideas, flights of ideas, that sort of thing. I'm going to concentrate on that in a separate video. But it must be a symptom, I guess, a manifestation of all those thoughts in your head. I speak quite quickly when I'm anxious. I realised that quite recently. But I've never really experienced anything like that. And I think people who aren't bipolar or don't have those mental illnesses, I don't think that it's a part of any normal state. I think it's something that normal people will never experience, actually. I think it's sort of exclusively a bipolar thing, possibly schizophrenic and anxiety related as well. So the treatment of pressured speech is synonymous with bipolar treatment. Mood stabilizers and antipsychotics, which are the mainstay of bipolar treatment, will most certainly get rid of precious speech because it is a part of mania, hypermania, mixed affective states. I think it's important to know that this is a very common symptom in bipolar disorder, because I think it's something that is quite subtle as well. When someone's talking very quickly or urgently, you don't necessarily think that they're in a pathological state, really. It's obviously communicating fine. But as with me, it's sort of one of the first signs, really, of entering into hypermania or mania. And it will be accompanied by all the other manic symptoms, being productive, flights of ideas, that sort of thing. Elevated mood, maybe, or maybe a dysphoric mood in the case of a mixed affective state. And if you're a carer of someone with bipolar disorder, watch out for this so that you can anticipate an episode. It's great if you can identify the onset of mania at the very outset, and then you can nip it in the bud with treatment, and the mania won't progress to something fully blown and potentially dangerous. So I hope that was useful. Thumbs up if you thought it was, and if you haven't already done so, you may want to subscribe to my channel, and then you can be notified of future videos, including those belonging to this series. Take care. Bye.